So chronic obstructive pulmonary disease is almost universally caused by directly smoking tobacco within the UK. So well over 90% of patients who are diagnosed with COPD in the UK have developed it as a consequence of smoking tobacco themselves during their life. If you think about smoking a pack of cigarettes a day for a whole year, that's 20 cigarettes a day for a whole year. That's quantified as one pack year. It's unusual to develop COPD if you haven't smoked more than 10 pack years, and often it's significantly more than that. So one pack a day for 10 years. But for many people, it's a lot more than that. Not everyone who smokes that amount develops COPD. Perhaps 1 in 5 of people who smoke that amount develop COPD. Why do some people don't? Some people do. Probably largely to do with genetic factors we don't fully understand that make some people more susceptible than others. The few percentage of people in the UK who develop COPD without smoking very much, it's often difficult to find what's caused it in them. Probably a combination of factors that all add up to increasing risk. Again, some genetic susceptibilities, things you've been exposed to through your life, perhaps passive smoking in childhood, or even when you were a fetus in your mother's womb. Some industrial exposures definitely cause COPD. Some industrial toxins, but others we still don't understand fully. So the main symptoms of COPD are breathlessness. So breathlessness starts on exertion only, and it gradually progresses over months and years. So people start to feel they're getting a bit puffed walking up the stairs or walking up the hill. And it becomes gradually more difficult to walk up the hill or up the stairs. And then for some people, if the breathlessness carries on progressing, they may become breathless walking very short distances or even walking from room to room at home. That doesn't happen to everyone, but that can happen. Generally, once you start to become breathless with COPD, treatment can improve it, but it doesn't take away all of the breathlessness. So you start to have breathlessness, which will be to a degree with you day to day, every day, and maybe worsening when you have a chest infection. Even when you don't have a chest infection, there'll be some degree of breathlessness. And that degree of breathlessness may well gradually get worse over years and years. That's very different from the symptoms of asthma, but generally there are periods of breathlessness interspersed by periods where there aren't any symptoms at all. Other symptoms of COPD: cough productive of sputum or phlegm, particularly in the morning, may well be the first symptom in people, often put down as just a smoker's cough. I always have cough and phlegm in the morning because I'm a smoker. Actually, that is a sign of developing chronic bronchitis, which is part of COPD. Should be a real red flag for getting rid of the cigarettes as soon as possible. Other symptoms: chest tightness, wheezing, fatigue. In some people, weight loss. In some people, weight gain and fluid retention. And then chest infections. So a tendency to have worsening after a cold, which goes straight to the chest, cough and phlegm, often needing treatment with antibiotics. Those are the main symptoms. So it's important to try and see a doctor if you have those symptoms, particularly if you've got a history of smoking in the past. Even if you gave up smoking years ago, the COPD symptoms can start many years after you've stopped smoking. And if you have those symptoms, you need to see your GP or a respiratory specialist. And the COPD is diagnosed by a doctor taking a history from you, so teasing out what the pattern of symptoms are, when did they start, did you have symptoms years ago, maybe when you were a child, which were never diagnosed, or did all these symptoms start in adult life? May well be a chest x-ray to check for other causes, and sometimes there's suggestion on a chest x-ray you might have COPD from some subtle changes. And then the main diagnostic test is a breathing test called spirometry, which is a test of your lung function. Spirometry measures the volume of air you can blow out over time during a forced expiration, and that can diagnose a reduction in the flow of air out of the lungs with people who have COPD. That's called airflow obstruction. Asthma is another possible cause of airflow obstruction, and telling the two conditions apart in some people can be quite tricky. That will rest a lot on your pattern of your symptoms, the age of onset, how variable your symptoms are, but also some of the changes in your lung function test can tell the two conditions apart. So the single most important management option is to do everything you can to stop smoking if you're still smoking. Continuing to smoke will speed up progression of the disease and will also make the other treatments less effective. There is a lot of support out there now to increase your chance of successfully quitting in terms of nicotine replacement, other medications. Some people find moving over to vaping is a safe alternative, a good step to cutting down. But again, vaping will not be entirely safe when you have COPD. You need to try and cut that down and stop that as soon as possible as well. Then there are supportive or preventative treatment options which are really important. When you have COPD, you're eligible for and will really benefit from the annual influenza and COVID vaccination, so that's important. Pulmonary rehabilitation, that's exercises. You can exercise yourself. Any aerobic exercise regularly during the week will really help keep you well and keep your lungs healthy, be that cycling, walking, swimming, an exercise bike. There are supervised physiotherapy programs of exercise designed for patients with COPD called pulmonary rehabilitation, and your doctor will be able to refer you for those. There's good scientific evidence that those really help keep patients with COPD healthy, keep them out of hospital, and give them better quality of life. Then the medical treatments, medications, the hallmark of treating COPD is inhalers, medication given through inhalers. There are various options out there now. Depends a little bit about your particular pattern of COPD. There are different patterns. Some people have breathlessness, but never really have cough and phlegm and really aren't troubled by chest infections, while others have a lot of cough and phlegm and have quite frequent chest infections. And there are different medications through inhalers that will suit either of those two. Some people with COPD have quite asthmatic type features, which you can tell with the pattern of their symptoms and sometimes on a blood test. And there are particular inhalers that suit them rather than the majority of people with COPD who do not have asthmatic features. Then for those patients who develop really quite severe COPD, which is not everyone, but for some people, they start to become quite low on oxygen, their blood oxygen level or their oxygen saturations become persistently low. And for them, having oxygen at home or lightweight oxygen when they're walking can really improve how they feel, their ability to walk, but also really helps improve their clinical outcomes. For a few people who have quite severe COPD, particularly when their pattern is more emphysema than bronchitis, emphysema is damaged air sacs that can be seen on a CT scan. For them, there are options of interventions such as surgery, lung volume reduction surgery, or minimally invasive alternatives such as endobronchial valve placement that can significantly improve breathlessness in some people, and a respiratory specialist can assess you for those. So I've kind of talked about a few already. Smoking cessation, stopping smoking. If you do vape for a period, trying to stop the vaping as well. Keeping active, so exercise, aerobic exercise. You will not do yourself harm by getting breathless. If you do get breathless, you can stop and recover, then carry on being active. It's good evidence that will help maintain how much you can walk and how much you can do and help keep you well. For those patients with COPD who are quite thin and have lost weight, trying to maintain their body weight is helpful, and that will often involve increasing their calorie input. So doing the opposite of what most doctors tell most people. So go for your high calorie chocolate, full fat milk, as well as keeping up your fruit and veg intake, or high calories to try and maintain your body weight for those patients. For those who are the opposite, who put on weight and have fluid retention, it's about trying to have a balanced, healthy diet and not put on excess weight. There's no other particular lifestyle changes really. It's about smoking, exercise, good diet.